Ever wondered what impact that common pill you pop might be having on your liver? The liver, that unsung hero in our body, diligently detoxifying everything we consume. Yet it's often overlooked when we think about the effects of medication. Today we're going to shed some light on this topic, highlighting the importance of understanding the effects of common drugs on this vital organ. We'll be navigating the intricate world of pharmacology, discussing 5 commonly used drugs that, if overused, could cause significant liver damage. These are drugs you may find in your own medicine cabinet: acetaminophen, alcohol, non-steroidal anti-inflammatory drugs, or NSAIDs, amiodarone, and methotrexate. Each with their own benefits when used correctly, but potentially harmful when misused. As we journey through this topic, we hope to arm you with knowledge and awareness. So, are you ready to delve deeper into the world of drugs and their effects on your liver? First on our list is acetaminophen, a common over-the-counter painkiller. You've probably reached for this remedy countless times to soothe headaches, reduce fevers, or relieve other minor aches and pains. Its accessibility and effectiveness have made it a household name. Acetaminophen is found in hundreds of over-the-counter and prescription medications worldwide. From Tylenol to Panadol, its presence is widespread. It's even tucked away in some of our cold and flu remedies. The sheer ubiquity of the acetaminophen testifies to its popularity and perceived safety. But here's where things get tricky. Despite its widespread use, acetaminophen is not without its dangers. Overuse or misuse of this seemingly innocuous painkiller can wreak havoc on your liver. When taken in excessive amounts, acetaminophen can lead to severe liver damage, even liver failure. You see, our liver is responsible for breaking down acetaminophen. However, in the process of breaking it down, a small amount of a harmful byproduct is produced. Normally, this isn't a problem. Our bodies can handle this byproduct easily, but in large quantities, that's when the trouble starts. The liver simply can't keep up, and this harmful byproduct starts to accumulate, causing damage to liver cells. This isn't just theoretical. Every year, acetaminophen overdose is responsible for more than 56,000 emergency room visits, 2,500 hospitalizations, and nearly 500 deaths in the United States alone. These are sobering statistics, reminding us of the potential harm that can come from misusing even common over-the-counter drugs. So, how can you protect yourself? The answer is simple. Follow the recommended dosage. Never take more acetaminophen than the package label suggests, and avoid combining multiple products that contain acetaminophen. When in doubt, consult a healthcare professional. Remember, even common painkillers can be dangerous when misused. Acetaminophen is a powerful tool for pain relief, but like any tool, it must be used responsibly. So, the next time you reach for that familiar bottle, give a thought to your liver. It's working hard to keep you healthy. Let's not make its job any harder. Moving on, let's talk about a substance that might not be considered a drug by many, but is often a major culprit of liver damage: alcohol. It's a social lubricant, a way to unwind after a long day, and an integral part of many cultural celebrations. However, it's also a substance that can wreak havoc on your liver when consumed in excess. When alcohol enters your system, it's your liver's job to break it down and remove it from your body. This process produces substances that are even more harmful than alcohol itself. One such substance is acetaldehyde, a toxic enzyme that can damage liver cells and cause permanent scarring, also known as cirrhosis. But what does excess really mean? For men, it's typically defined as more than 4 drinks in a day or more than 14 in a week. For women, it's more than 3 drinks in a day or more than 7 in a week. However, these are just guidelines, and individual tolerance can vary greatly. To put the severity of this issue into perspective, let's consider some real-life examples. Take the case of John, a middle-aged man who enjoyed a couple of beers after work each day. Over time, this habit led to the development of cirrhosis and ultimately a liver transplant. Or consider Sarah, a college student who partook in binge drinking and ended up in the hospital with acute alcoholic hepatitis. According to the National Institute on Alcohol Abuse and Alcoholism, alcohol-related liver disease was the primary cause of almost 1 in 3 liver transplants in the United States. That's a sobering statistic that underscores the very real dangers of alcohol overconsumption. So while it's perfectly fine to enjoy a glass of wine with dinner or a beer with friends, it's important to remember that moderation is key. Overconsumption of alcohol can lead to serious health issues, including liver damage, and can even be life-threatening. So, the next time you reach for that extra drink, think about your liver. Next up, we have non-steroidal anti-inflammatory drugs, or NSAIDs for short. These are a group of medications commonly used to relieve pain, reduce inflammation, and lower fever. You may recognize some of the names like ibuprofen, aspirin, or naproxen. They are readily available over the counter and can be a real lifesaver when it comes to managing everyday aches and pains, menstrual cramps, and arthritis symptoms. But here's where things get a little tricky. Despite their benefits, NSAIDs are not without risks, especially when it comes to your liver. Now, you might be thinking, but I've been using these for years without any issues. That may be true, but it's essential to understand that every person's body is different and can react differently to these drugs. When used appropriately and under the guidance of a healthcare professional, NSAIDs are generally safe. However, overuse or misuse can lead to serious complications, including liver damage. This damage can range from mild to severe, and in some cases can even progress to liver failure. Now let's bring in some real-life examples to drive this point home. In the United States alone, NSAIDs are estimated to be responsible for nearly half of all drug-related liver injuries. That's a staggering figure, considering the widespread use of these drugs. And it's not just adults at risk. Even children can experience liver damage from NSAIDs if they're not used correctly. So what's the takeaway here? While NSAIDs are incredibly helpful in managing pain and inflammation, they should be used responsibly. Always follow the recommended dosage and never use them for longer than necessary. Also, remember to consult your healthcare provider if you're unsure about anything or if you're experiencing any unusual symptoms. In conclusion, NSAIDs, like any medication, come with potential risks. It's our responsibility to be informed and use them wisely. So, the next time you reach for that bottle of ibuprofen, remember to consider your liver and use it responsibly. It's clear that NSAIDs, while helpful, need to be used responsibly. Fourth on our list is a medication used to treat heart conditions, amiodarone. This drug is a powerful tool in the arsenal of cardiologists, primarily used to manage and treat certain types of irregular heartbeats, known as arrhythmias. It's a drug that can be a game changer for those living with these heart conditions, allowing them to lead more active and fulfilling lives. However, as with any powerful medication, amiodarone does not come without its potential drawbacks. One of the most serious of these is the risk to the liver. Amiodarone has been found to cause liver damage in some individuals, an unfortunate irony considering its life-saving potential. So how does this happen? Amiodarone is metabolized by the liver, and in the process can cause inflammation and, over time, scarring. This scarring is known as fibrosis and can ultimately lead to cirrhosis, a severe form of liver disease where the liver's cells are so damaged they can no longer function properly. But let's put this into perspective with a real-life example. Consider a middle-aged man, we'll call him Tom, who has been battling a severe form of arrhythmia. Tom's quality of life has improved dramatically since starting amiodarone. However, after a few years of use, routine blood tests reveal elevated liver enzymes, a sign of possible liver damage. Further investigation confirms the diagnosis. Unfortunately, Tom's story is not unique. Studies have shown that liver damage from amiodarone is not uncommon. In fact, approximately 1 in every 25 to 50 individuals on amiodarone therapy may experience liver damage. This is why regular liver function tests are recommended for those on the drug. Despite the risks, it's important to remember that for many, the benefits of amiodarone far outweigh the potential drawbacks. But it's a stark reminder that even life-saving drugs can have serious side effects. It underscores the importance of regular checkups and open communication with healthcare providers. After all, knowledge is power when it comes to managing our health. So, as we move on to the next drug on our list, let's keep Tom's story in mind. It's a reminder that even life-saving drugs can have serious side effects. Last but not least, we have methotrexate, a drug used primarily to treat cancer and autoimmune diseases. This powerful drug, often prescribed to manage conditions like rheumatoid arthritis and certain types of cancer, has been a game changer in the medical field. It works by suppressing the immune system, reducing inflammation and slowing the growth of cancer cells. But like all potent medications, it comes with its share of risks. One such risk lies in its potential to cause liver damage. Despite its therapeutic benefits, methotrexate can lead to an array of liver-related issues, ranging from mild liver enzyme abnormalities to severe fibrosis or cirrhosis. Now, this doesn't mean everyone who takes methotrexate will experience these side effects. but it does underline the importance of regular monitoring and careful usage. Consider the case of Jane, a 55-year-old woman battling rheumatoid arthritis. She was prescribed methotrexate and experienced significant relief from her symptoms. However, routine blood tests revealed elevated liver enzymes, an early sign of potential liver damage. Thankfully, her doctor caught this in time and adjusted her treatment plan, averting serious harm. Such cases underline the importance of regular monitoring when using methotrexate. Doctors often recommend routine blood tests every 3 to 6 months to check liver function. These tests are crucial in detecting any signs of liver damage early on, allowing for timely intervention and adjustments to the treatment plan. To put this into perspective, a study found that out of thousands of patients taking methotrexate for rheumatoid arthritis, around 20% experienced elevated liver enzymes at some point. While the majority of these cases were mild and resolved with dose adjustments, it serves as a stark reminder of the potential risks associated with this medication. It's important to remember that methotrexate plays a vital role in managing serious medical conditions. Its potential side effects should not deter those who need it from using it, but rather underscore the need for careful usage and regular monitoring. So next time you or a loved one is prescribed methotrexate, remember to keep a close eye on your liver health. As we can see, even necessary drugs like methotrexate require careful usage. We've explored a range of drugs, from over-the-counter painkillers to essential heart and cancer medications. It's clear that each of these substances, while beneficial in their prescribed uses, can potentially cause significant harm to the liver if misused or overused. Acetaminophen, a common household painkiller when taken in excess, can lead to serious liver damage. Alcohol, a socially accepted substance, can also wreak havoc on your liver over time. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, can cause liver inflammation if overused. Amiodarone, a heart medication, and methotrexate, a cancer medication, both carry risks of liver damage, highlighting the importance of careful dosage and regular monitoring. This information underlines the importance of responsible drug use and the potential health risks associated with their overuse. Remember, your health is in your hands. Use drugs responsibly and always consult your healthcare provider if you have any concerns.